Hello, everyone. This is our IHSS Caregiver Education presentation. Say goodbye to restless nights. My name is Riley.
My name is Elijah.
My name is Denise.
I'm Jocelyn.
Hi, and I'm Valeria.
So first, here's our acknowledgement. This project is an interdisciplinary partnership between UCI School of Nursing, Division of Geriatric Medicine and Gerontology, and OC Public Authority IHSS program. We thank Professor Jung-Ah Lee, an associate professor in the UCI School of Nursing, and the assistants from the Geriatric Workforce Enhancement Program, the UCI Department of Family Medicine, and the Division of Geriatric Medicine and Gerontology. Here is our outline for our presentation. And next, I'm going to talk about sleep disorders. So the first sleep disorder is insomnia. Some of the symptoms include trouble falling asleep, early morning waking, daytime sleepiness, and chronic insomnia. And some of the causes can be heavy food, blue light, medications, stress, bad habits, and caffeine. And then next we have the sleep disorder, sleep apnea. Some of these symptoms include snoring, gasping for air, interrupted sleep, and daytime sleepiness. And then some of the risks of untreated sleep apnea include depression, diabetes, heart failure, blood pressure, high blood pressure, and concentration and memory problems. And then next we have a true or false question. Insomnia and sleep apnea are two of the most common sleep disorders. True or false? The answer is true. Next, Elijah is going to talk about sleep cycle.
Thank you, Riley. Now I'm going to talk about the sleep cycle. So the sleep cycle consists of 4 parts: stages 1 through 3, and REM sleep. Stages 1 through 3 make up 75 to 80% of sleep, while REM makes up 20 to 25% of sleep. In stage 1, this is the transition to sleep, and it's when drowsiness ends. In stage 2, we have light, stable sleep, and this when chemicals block the senses, it lowers the heart rate and eye movement, and your body temperature also decreases. Next is stage 3. This is deep sleep, and it's hard to wake during this stage. You also have your lowest blood pressure and respirations in stage 3, and you accumulate your energy. Finally, we have the REM sleep. REM stands for rapid eye movements, because during this stage, that's when your eyes move around very rapidly. And this stage also includes intense dreams, skeletal muscle paralysis, and memory consolidation. And now I'm going to talk about a few factors about sleep that change as you age. So as age increases, the sleep time decreases, and your sleep structure also becomes more fragmented and less efficient. Now we have a multiple choice question. What stage from the sleep cycle includes rapid eye movement and intense dreams? A, stage 1, B, stage 2, C, stage 3, and D, the REM stage. And the answer is D, the REM stage. And next, I'll pass it on to Denise. She's going to describe the effects of sleep on your health.
Thank you, Elijah. So now we're going to talk about how does sleep affect your health. First off, we're going to start with diabetes. Insufficient sleep has been linked to increased risk for development of type 2 diabetes. Good quality of sleep is also important because it improves blood sugar controls. Next, we're going to talk about cardiovascular disease. People who suffer from sleep apnea are more likely to have hypertension, stroke, cardiac arrhythmias, and coronary heart disease. Sleep apnea may also be an important predictor of atherosclerosis, which is the hardening of the arteries. Next, we're gonna have Jocelyn talk about the tips for better sleep.
Thank you, Denise. So some of the tips we have are being consistent. So going to bed at the same time every night and waking up at the same time every morning, as well as exercising. So being physically active during the day by going on walks, biking, etc. As well as having a comfortable environment while sleeping, such as a nice quiet room with a comfortable temperature. Removing electronic devices from the room, such as phones, computers, and TVs. Avoiding napping late afternoon or evening, developing a bedtime routine, using low lights in the evenings, staying away from caffeine late in the day, and avoiding alcohol before going to bed. Time is also an important factor, so make sure you start your day at the same time every morning and get enough sleep to help you regenerate, which would be about 7 to 8 hours of sleep at night. Maintain a healthy diet and reduce your caffeine intake in general, as well as limit the alcohol and cigarette usage. Limit the amount of fluids taken before going to bed, which will help prevent waking up at night to use the restroom. And lastly, having dinner 2 to 3 hours before heading to bed. And now Valeria will continue this section.
Thank you, Jocelyn. So activity. Being active throughout the day will greatly increase your sleep. This includes, but is not limited to, morning walks, yoga, and riding a bike. The slightest bit of movement can greatly improve your sleep in addition to increasing your exposure to sunlight. And now we have a true or false question. True or false? Older adults need 5 to 6 hours of sleep per night. This is false. Older adults are recommended to sleep 7 to 8 hours per night, not 5 to 6. Light at night. Limiting your exposure to electronic devices at least 2 to 3 hours before you sleep will improve your quality of sleep. This is included with blue light exposure during the evening. Using blackout curtains and utilizing a red light at night will help promote sleep throughout your nighttime. Naps. Implementing a 30-minute nap a day can ensure optimal sleep. We do advise to avoid taking naps in the late afternoon and make sure that you have a restful environment when you are taking that nap. Melatonin. We must avoid taking melatonin or any type of sleep aid without a prescription due to their ability to decrease deep sleep and increase light sleep. And now Denise will continue this discussion with promoting safe sleep.
Thank you, Valeria. So now we will be talking about how to have a safe sleep. The first thing we can do is install rails in bedrooms, bathrooms, and anywhere else where there are stairs in order to prevent falls. We can also lock all doors to the outside and wear a personal medical alarm. We can avoid falling asleep in chairs or couches or beds that are high. We can remove clutter from beds, like excessive pillows or blankets. We can get rid of tripping hazards and make sure the floor is clear of clutter. Use non-slip rugs and make sure edges and corners are secured in place. And finally, ensure paths are adequately lit, for example, by using a night light. Next, I will be talking about some helpful sleep products. Blackout curtains are curtains that create total darkness in the room, making it easier to fall asleep and reducing the chances of waking up due to light disturbances. Natural light alarms are alarm clocks that wake you up gradually by slowly flooding the room with natural light. Pressure relief mattresses reduce pressure areas to help relieve pain from aching joints or bed sores. White noise machines help drown out any unwanted noises which may disrupt sleep. Motion activated lights will turn on if the elderly needs to use the restroom and will automatically turn off to allow for a good night's sleep. Adjustable beds allow seniors to adjust their position for total comfort and can be lowered to make it easier to get in. Safety pads include padded bed rails and guards that can reduce the risk of injury if the elderly falls from the bed. Finally, medical alert buttons, which are worn around the neck and used to summon help when they press the button. Now we have a multiple choice question. The question is, which product is considered helpful when trying to sleep? A, blackout curtains, B, natural light alarms, C, adjustable bed, D, medical alert button, or E, all of the above. The answer is E, all of the above. Next, we will have Elijah talking about how to keep a sleep diary.
Thank you, Denise. So what is a sleep diary? A sleep diary is a daily record of important information related to sleep. This diary will document the total sleep time and any interruptions in your sleep. If you have trouble sleeping, a sleep diary may help identify which habits are impairing a good night's rest. Doctors often require people to keep a sleep diary, which will help them evaluate their sleep and identify which factors are affecting their sleep. Here we have a picture of a sleep diary, and you can print these out. And as you can see, there are many boxes for the different times during the day. And in these boxes, you can note down when you woke up, when you went to bed, when you took a nap, or when you ate some food. How can caregivers record a sleep diary for older adults? So the first step would be to print out a sleep diary. And for around 10 days or however many days you can document a consistent sleep schedule, you can note when the older adult goes to bed, wakes up, feels sleepy, takes naps or exercises, drinks alcohol, has caffeine, or eats food. And third, you can review the sleep diary to see what activities are associated with poor sleep quality. And lastly, you can bring the sleep diary to the older adult's doctor. And finally, we'll pass it off to Riley to conclude.
Thank you, Elijah. So let's recap. Sleep is important for your health. Lifestyle habits such as diet and activity can greatly affect your sleep. Safe sleep is necessary, and getting a good amount of sleep is very important. A sleep diary can also provide helpful insight into sleep problems. Here are some additional resources to help you with your sleep. We have tips for sleep hygiene, independent non-profit organization aimed at helping those with chronic circadian rhythm disorders, videos explaining sleep hygiene, and a printable sleep diary for caregivers. Next, here is our first page of references. And then here is our references, the second page. And then we just wanted to thank you for watching our presentation. If you have any questions, you can go ahead and reach out to our professor, Professor Jung-Ah. She is super helpful.